If you think about how this regenerative aesthetics is that like you're just kind of like putting your train station at a stop while everybody is still going 100 miles per hour, you know. Unfortunately, the train is still going to move forward. It's not going to stop forever, you know. That'll be like something plastic surgery, right?
Mm.
It's still going to move forward, but at a slower pace. So you do another treatment, you're putting it as a stop again, you know. And again, well, everybody's like 200 miles per hour all the way there, and you're just kind of like really extending it and then stopping it on each station, so to speak.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Jenny Jimenez, the CEO and founder of Gesthetics, who brings over 25 years of advanced medical expertise spanning ER to ICU. She holds both a master's and doctorate in advanced nursing practice and is trained with top aesthetic experts across the US and UK. Since entering aesthetics in 2020, she's become known for her meticulous technique, natural results, and luxury-centered client experience. A world traveler and wellness enthusiast, Jenny infuses her global inspiration into every aspect of her artistry. So Jenny, welcome and glad to have you here.
Thank you. Thank you. So excited to be in the podcast today.
Well, I'm glad to have you here. So let's start with this, Jenny. How did you first get interested in the medical field?
Oh, God. Since I was probably two, was given a doll, and back in the day, it's like, I'm gonna be a doctor, and it just kind of stuck all the way. Initially, I was like, okay, I'm gonna start nursing as my path, and then get my medical degree. But things changed, life happened. Became a nurse. Came to Chicago. Originally from the Philippines, came to Chicago, became a nurse there, and then I mean, I was still going back to school to get my master's, my doctorate, but then I decided like, maybe not, maybe not an MD, but at least a DMP. But yeah, it's the only thing I know. It's the only job I had.
Okay.
Mhm.
And so how'd you make the transition into aesthetics then?
Oh yeah, so I've worked ICU ER hospital for about I would say 28 years. And during COVID time we were first care responders, and during that time it was just really weird. You don't know if that's the day that you're gonna die
Mm.
or whatnot. And I really have so much respect for the frontliners, and so that was scary that time. And then post COVID happened, which was worse for the emergency department. We were just getting all of these patients that are making me burn out,
Mm.
basically. But during the COVID time, I started kind of dabbling into aesthetics on the side, and to me, it was fun. It was really nice that I was doing, and so in 2023, I decided that I am gonna turn my life around and focus more on aesthetics and regenerative medicine than emergency room. And like I said, I just completely 100% left that life, and now I'm here in aesthetics.
Okay. So what caused you to want to start your own practice then? I mean, and it sounds like you got burned out a lot from being in the hospital, but why go from there to starting your own practice instead of working kind of in more private practice?
Yeah, well, I to be honest with you, I have no idea how business goes. I've been clinical for all of my life.
Mm.
And up until now with the business, we've been like 2 years now, and I'm still honestly swinging it
Mm.
as I learn, as I go. But I've always seen, my mom has always been a businesswoman, and I feel like we all have that business thing inside. And so when I was pivoting towards aesthetics, it's just like, okay, well, maybe I'll just build my own business. It's something that I was going to do part-time while still working in the hospital. But again, when things started turning around and I was seeing the opportunity, I'm just like, I'm just going to go full force in this 110%.
Mm.
And that's where we are right now.
Okay. So now that you have your practice, I want to go into some of the treatments that you provide. And I want to start with biostimulators.
Yes.
What is biostimulators?
So biostimulators, the word bio, which is life, stimulate is to, of course, bring forth growth, right? And
Mhm.
so that's the thing with regenerative aesthetics now, biostimulators. Back in the days, all we have are like fillers, Botox, but now we have more quote unquote natural way of beauty and anti-aging. And I like biostimulators because the results are more, again, more natural. And that's what our brand is, to build your own collagen to bring back or like not really not give you a whole face but just kind
Mhm.
of like take down years or like of the person that you love or the person that you like looking to
Mhm.
in a more natural way. So one of the biostimulators that we love that I personally do and I love on myself is a PDRN, or what's mostly by Kim Kardashian, the salmon sperm facial.
Mhm. Okay.
Oh,
So the
I don't
bios
even know, can I mention that?
yeah, yeah, yeah. Should be fine. I mean, it is what it is, right? So with the biostimulants, it sounds like it's really kind of your body using its own natural processes to heal and make your skin look younger.
Yeah, so basically, yeah, so as we age, we lose certain things in life. Collagen, elastin for one. There's muscle loss, there's bone loss, and all that stuff. But these products, these biostimulators that we use, there's natural and there's also synthetic. Um, and basically, you put this or like, you do this treatment to induce that cascade of healing or regenerating, so to speak, because as we age, we continue to metabolize all the oxidative stress and all that stuff. And that's how everything like skin laxity starts happening, the aging lines and all this stuff. So it's really just like you're not really stopping the aging, you're just kind of like extending it, right? Like everybody's in this train to aging. Everybody. I don't want to be on it, but I'm on it too.
Yeah.
And if you think about how this regenerative aesthetics is that like you're just kind of like putting your train station at a stop while everybody is still going 100 miles per hour, Unfortunately, the train is still going to move forward. It's not going to stop forever,
Mhm.
That'll be like something plastic surgery, right?
Mhm.
It's still going to move forward, but at a slower pace. So you do another treatment, you're putting it as a stop again, And again, well, everybody's like 200 miles per hour all the way there, and you're just kind of like really extending it and then stopping it on each station, so to speak.
Okay. So for these biostimulators, like what is it? Is it a cream? Is it a liquid? Is it like needles that's being punched into your skin? Like what exactly is the biostimulator?
Yeah, so one of my favorite biostimulators, like I mentioned, we have a natural and synthetic one. And I want to focus more on the natural one, which is PDRN. So PDRN is short for polydeoxyribonucleotide. And there are multiple ways on how to administer this, right? In Korea, which is very famous, and the product that we use here is Regeneron. Oh, I don't know if I can mention brand names, but the product we use there is Regeneron. Anyway, in Korea, it's being used for over 20 years. And also in UK, and there they do it as an injectable, like a skin booster. They inject it into the dermis to start that cascade, that healing cascade. Unfortunately, in the US, we are a little bit more behind as far as like aesthetics, but also the FDA approval and all this stuff is a bit slower. So it's administered via microneedle or laser. So we use like a drug delivery system to open up the skin to be able for that polynucleotide to get into the deeper dermis to start that cascade.
Okay. So pretty much someone comes in, then they get the microneedling on their face. And basically what the microneedling is kind of putting these small holes into the face, and then this biostimulator is being put on top of it to basically get into the skin, and then from there it starts its healing process or whatever it does.
So basically with the microneedle, you're creating the microchannels to open up because the skin is a really good barrier for everything, right? There's a reason why certain molecular structure they can't get into the skin. There's protection, right? And PDRN is a little bit more of a bigger molecular structure. So for it to be able to get into the deeper dermis, so we have the top layer of the skin, which is the stratum corneum, and then it goes through down to like the deeper dermis. You have to create the channels, and microneedle is one. And I also mentioned the laser. The laser is another one, it doesn't, you don't see it poking holes just like a microneedle, but it still opens up the layers of the skin in a way the laser works to be able to like, it's called the laser drug delivery system. Um, so then you do the laser and then you put in the PDRN and it still goes deep into that dermal layer.
Okay. And you mentioned that there's synthetic and then there's natural. What's the difference between these two?
So like synthetic would be if you've heard of the term Sculptra or Radius. So Sculptra is PLLA and Radius is calcium hydroxyl apatite. So they're basically called synthetic because they didn't come from natural sources. PDRN came from salmon gonads or testis, and that's why the infamous term salmon sperm.
Mm,
And so it's a highly purified DNA of of the male salmon trout or chum salmon. And this tissue is just because it contains a high concentration of the sperm cells and the richest and purest of the specific DNA fragments which we need. And the final product is been purified, removing all active proteins and peptides, which ensures there's minimal risk of immune reaction. Now, the synthetic ones, which is the Sculptra, which is PLLA, or Radius, which is calcium, they're synthetically made in the lab. We do have calcium in our body, so Radius is a little bit more natural, so to speak. But Sculptra, PLLA, polylactic acid is pure synthetic. We don't have that in our body.
mm,
And it induces collagen in a way of inflammation when injected into the face. So if you think about it, natural biostimulator, it triggers the natural healing cascade. It triggers two pathways for healing. Meanwhile, the synthetic one, they trigger inflammation to cause that collagen formation.
mm. Okay. So synthetic can work, but it's a little bit more from like an inflammation standpoint, whereas the natural is a little bit more like you're using your the own body's regular mechanisms to
Yes.
promote that.
Yeah. Yeah.
Okay.
There's two biological pathways how that works, right?
Mhm,
So when the product is introduced to the face or like even on the hair, because we also do it on the scalp for hair regeneration.
mhm,
Um, it there's two pathways that goes through it. The first pathway is called the adenosine A2A receptor, which signals the cells to I'm gonna say inflammation again too, because it's like not like inflammation where it's inflammation because it's a foreign body,
mhm,
but it signals the cell to reduce inflammation, and then it stimulates the production of the new collagen in blood vessel. And then the second pathway is the salvage pathway, where it supplies ready-made nucleotides, which are the building blocks for the DNA, and it allows the damaged cells to immediately repair and rebuild without wasting energy. And I do have a simple analogy for this because some people just like, what the hell did you just said? So basically, the simple analogy of understanding is, say, in a construction site, right? To make
mhm,
it an easy picture,
mhm,
imagine your skin is a damaged building.
mhm,
Okay, now not necessarily have an open wound. Let's just say like you're aging, you have loss of elasticity and all that stuff. So PDRN is doing two things at once. First, it acts as the chief site manager by sounding the alarm. So it's like, hey, we have a problem in here, there's fire or whatever. So that is the A2A receptor. That is the signaling receptor saying like, hey, we need help in this area. In this case, if we're doing it on the face or we're doing it on the scalp, right? And so that alarm, that chief manager is saying, go over there, stop the damage, and start to rebuild. Then simultaneously, it delivers high quality prefabricated materials. And this is the salvage pathway, the second pathway, that directly tells the construction crew, go over there with all of these materials, allow them to repair the structure instantly. And it's both the instruction and the essential material for revitalization. So hopefully that makes sense, make it easier.
Yeah. Okay. So then in what situation would someone want to get this? Like, is it because they want to have skin that glows more? Do they have maybe damaged skin? Like, in what situation would someone be able to really benefit from this treatment?
Yeah, so honestly, anybody who's in their late 20s onwards, because um as I always tell my clients, right? Like we actually start losing collagen in our late 20s. Back in the days when I was working in the ER, I thought we start losing collagen in the 40s. I was wrong. I started a bit late, but it was actually in your early 20s. And then as far as like elastin, the other component that helps with the skin, um, we are born with only a certain amount of elastin. Your body won't produce anymore. Collagen you can reproduce, but at a certain age, it just becomes slower and slower, and then that's it. Elastin, when you're born, after a few hours, it's like, okay, say for example, you're just gonna be given 10,000 elastin for the rest of your life. That's it. And then you're gonna age and metabolize that all through your years. So that's why some people they look older faster, some people don't, especially like different skin types as well. Is because of that availability of elastin, right? And so, with the structural decline beginning early, hitting the peak of collagen in our mid 20s and elastin production ceasing after childhood, by age 25 to 30, we are losing about 1% of collagen per year. So, ideal candidates would be anybody who's looking for prejuvenation. These are your late 20s to mid 30s. Um, Technically, you wanted to do it in the late 20s. You want to do it like more preventative, where PDRN is an intensive DNA repair system designed to fortify that foundation against future damage. Now, people will say like, well, I'm already in my 40s or 50s and my late. So now what we're doing more in that age, like in my age range, is more correction. And so it's absolutely not too late for anything. So for mature patients, the focus shifts to correction and repair. So PDRN still strongly stimulates existing fibroblasts to produce new collagen and is excellent at reducing the chronic inflammation that drives the aging, providing measurable improvement in skin thickness and overall texture.
Okay. Now, Jenny, with this treatment, I'm sure that you get a lot of people who just don't know what it is, or there's a lot of misconceptions or myths around it. What would you say are some of the most common misconceptions you hear about this type of treatment?
I think the most common misconception, for one, arises from not knowing what it is, right?
Mm,
And then the other thing is that what TikTok and social media, it's just so many information out there that you really just have to filter which one is true, which one is not. And I think one of the misconception out there is that you get one treatment and here you go with like glowing skin, amazing
mm,
skin.
mm,
And what I always tell clients is just like, okay, it- I like doing a side by side example because I feel like it's easier, right? Like say for example, you want to lose weight. You go to the gym one time, you're not gonna lose all the weight. You go eat a good diet for one day, you're not gonna lose 10 pounds immediately, right? And so one of the misconceptions is like, oh, I got one treatment, nothing happened. I didn't get the glass skin or the glowing skin that you were talking about. But then it's like, okay, one treatment is a treat. You're treating yourself. You're helping rebuild, regrow. You're starting the healing cascade. You have to do a series of treatments to be really able to see the result of that long term. And the other thing is that, like, again, it depends on like how your diet is. What are you drinking? Are you drinking enough water? Are you sleeping enough? What is your stress levels? These are all factors that help build the collagen. And so that's the one misconception. The first one is just like, oh, I got one treatment, it didn't work. Or some people, they got one treatment and it's just like, like, oh my God, it's the best thing ever. But then again, if you look at like, okay, well, what are they doing at home? Are they doing really good skincare? And the other thing is that like any treatments in the medical spa, this is only 20%. What you do at home is 80%. Your skincare, your habits, your exercise, all that stuff. So that's one of the there's a few more, but that's main thing is like, well, I got that done, it didn't work, or I got that done, it did work.
Mhm. Okay. So for the average person, how many treatments should they expect to get before they start seeing some of those results?
Yeah, so we follow what's called a facial treatment protocol, and it's designed to achieve a cumulative regenerative effect. So consistency is going to be key, right? And so we typically recommend like what's called an initial phase or the loading phase, a series of 3 to 4 treatments, spaced 3 to 4 weeks apart, and this builds the foundational polynucleotide concentration needed to activate the cellular repair and initiate new collagen synthesis. And then after that, you go to a maintenance phase, which is follow-up sessions every 4 to 6 months after the initial series to maintain the results and continue protecting the cellular structure. Now, also depending on like the where you live, what are your lifestyle? Like say, for example, right now we are in November, it's going to winter time, skin gets more dehydrated. You might need a little bit more closer treatments, or you went partying, drinking all week. Now your skin is dry and dehydrated. So those are other factors, but the ones that I mentioned are kind of like our treatment protocol.
Okay. And Jane, let's say someone's looking to get this treatment done, but they don't know who to go to. They're not sure which provider to choose. What type of advice would you give that person when they're doing their search? How they can find that provider that knows what they're doing and can get them that great result?
Great question. Just because it's been, there was I forgot who was this talk show host that says the aesthetic community right now is like I don't know if I can say the word, but can I say the word?
Sure.
It's a shit show right now. Well, because like there's so many for people who are for one unlicensed.
Mm,
And so that is the first thing that you wanted to do. Here in our medical spa, safety is our priority. All of our licenses is posted at the front. We even made our clients sign the notice of acknowledgement saying that we are all licensed professional here. That's the most important that you need to find out like, okay, is this person a licensed professional? And it's so easy to look it up, a board of medicine, you go online, board of nursing, you go online, estheticians, you go online, see if they're licensed. That's the first one, right? Because I believe that if somebody has a license, they'll be more quote unquote scared to do something illegal because they don't want to lose that license. They work so
mm,
hard for that license. So that's number one. Number two is also where are they working, right? Not so much of like, oh, it's a small place, it's a big place. No, but like, is it a legit place that they're not somebody's backyard,
mm,
not somebody's garage? And
mm,
I get it. There's concierge services, but then again, like just look and see like how does this person look like? Um, are there like any before and afters? And if there's no before and afters, then kind of see like, okay, have the conversation of how many years have you been doing this? You know, I believe that experience is key. And also, who is the team that this person is working around with? Now, there'll be like some single injectors and all this stuff. But again, the most important thing is just do your research, make sure they're licensed, make sure that whatever their license is, they're practicing within their scope. Because there's some people, yes, they do have the license, but they are practicing way beyond their scope. Like they shouldn't be injecting. They shouldn't
mm.
be performing X, Y, and Z. Because then now, oh, and finally, the other thing too, that the product they're using is legitimate and US FDA approved. Just because there's so many counterfeit products out there. So those are the three main things that I would say they need to kind of do their research about.
Okay, great advice. Now, Jenny, I'm curious, what role do you believe that creativity plays in how you approach your patient care? Yeah, so like when it comes to creativity, like how creative do you want to get when you're working with your patients, working with your clients? Is it a pretty straightforward that, oh, for every single person it's this protocol? Or do you have to be creative and like, oh, like for every individual situation, it's something that's different that requires that creativity to find that solution?
Oh, yes, definitely. So basically, our consultations here takes about 1 hour for first-time clients because I really want to first get to know them, what their goals are, if their goals are realistic or not. It's very important to be able to discern if a client has what's called BDD or body dysmorphia, because those clients you will never make them happy. You need to refer them to something else, to somewhere else.
Yeah.
But like I said, everybody gets a tailored treatment here. For one, we start with like, what are their goals? What are their skin looking like? And we do an AI analysis to really see how not only the superficial part of their skin is looking like, but also on the deeper dermis to be able to really tailor the treatment. Like, how aggressive can we get? Is this going to give us a good response? Is this not going to give us a good response? So we start from like the things that they use at home, because like I mentioned earlier, 80% of what they use at home is what's going to make or break the treatment, right?
Mm-hmm.
And everybody uses 10,000 products. We really tailor them down. And then each treatment, I really tailor them down. Not everybody gets a cookie cutter approach, because sometimes they would have A problem, B problem, C problem. And so there's no one treatment that can take care of all of that. So it's going to be like more of like a combination multimodal approach to really get the best results. Typically, the treatment protocol that I mentioned to you, that's just like a guideline, but everybody gets a whole tailored treatment plan.
Got it. Now, Jenny, I'm also sure that throughout your experience, you've had some memorable cases, maybe challenging cases. Is there maybe one story that comes to mind that you can share of someone that came in and how you were able to get them a great result in the end?
Sorry, I'm laughing because I don't know if you need to cut this, because I'll be firing clients. They don't follow, and I'm like, you're fired. I don't want to see you anymore.
Yeah, maybe not an example of that one. Maybe like a more
I
a
know.
happier one.
Okay, sorry. I just fired somebody because she wanna do what she wanna do. Then she come back here and was just like, look at what happened to my face. I'm like, well, what did you do? Well, I went to Sephora. I'm like, did I told you to go to Sephora? Okay, so let's return back. What was the question again?
So if there's a memorable case or a challenging case and how you're able to get them a great result in the end.
Yeah, so one of the greatest cases, which is actually was so happy with the result that she allowed me to post her photos in our social media. So basically, she has this like really deep acne scars. She hasn't done anything on her face for X amount of years. Um, but then finally, she was just like, I'm turning 40. I want to do something for myself, and I want to get this skin in 3 months. And I'm just like, okay, this is damage from years. And so first I have to set realistic expectations. And typically what I do is that most of the time I under promise and then I over deliver. Like literally over deliver to the best of my ability. Like I will make this happen. And so it was like a combination of acne scars and then some PIH and then some skin laxity. And so I really created a multimodal approach for him and really stick with a timeline. Every 2 weeks, I was seeing her at the spa. But what I like about it is that she followed protocol and skin regimen at home. And that is why her result was amazing. And for those listening to the podcast, and I know with the HIPAA, she will be the first one that's pinned on our social media, the top right one, and you will see the skin result on that one.
Awesome. Great story. Jenny, where do you think the future of aesthetics is going?
I think as far as like the future aesthetics, it's just gonna get not bigger, but it's gonna get better. As technology evolves, we are learning more things that are more quote unquote natural. Again, in the beginning, it was just fillers and Botox, and now we have all these different types of biostimulators. Technically, like it's just gonna get bigger, better. More studies are coming underway, and what's good about it is that now most of these treatments are really, they're doing random clinical trials and evidence-based instead of just like, oh, let's do this, this works, and more of like, it's more quantitative analysis with like evidence-based, and they're doing scientific-based studies versus anecdotal.
Mm,
So I think that's where And that's what's good. That's better because again, we're going back to the safety profile, right? All of these treatments that we're doing for clients, we want to make sure that it's safe. Not only are we meeting the aesthetic outcomes, we want to make sure it's safe in the long term.
Yeah. Okay. Now, for your practice, Justhetics, what's your vision for your practice?
My vision for my practice is to continue promoting the natural brand. And again, we're not here to change your face. We are just here to help you bring back the face that you once loved. And meaning that is anti-aging, that is health. Um, we strongly believe that if you look beautiful, you will feel beautiful. If you look good, you will feel good inside. We are in a space where we are not just treating the outside, but also the inside. Because if the inside is not taken care of, whatever you're doing the outside, they're not going to be happy, it's not going to work. And so we try to approach each and every of our client holistically. And aside from like the aesthetic part that we do, we also have like the IV hydration. So, we really get like all the vitamins, the minerals, and all this stuff, but it's all anti-aging and prevention and wellness. And the vision the vision is just to make more clients be aware that, hey, if there is something to build up your confidence, then come to us. It's something that we can work with. A lot of and also like a lot of people thinking that aesthetics is just for females, but it's also for males. It's for everybody. Male, female, everybody. It's just really like how you want to look at yourself, how you want to look at aging. So.
Okay, awesome. Well, great vision. So now, Jenny, I have one last question for you, but before I ask it, I want to point people to your website at justheticsbar.com.
Yes.
Now, last question for you is, what does beauty mean to you?
Beauty is how you not perceive it, but beauty is your perspective, right? If looking beautiful is something that you're exercising or losing weight, that's beautiful for you. That's your perspective. If your beauty is getting a facial or investing in your skin every month, that's your perspective. And that's how I see beauty is, what is your perspective? My perspective of beauty is taking care of yourself. You only have one body. You only have one face. You only have one life. And choose wisely. Choose how you want to invest on it, And that's how I just overall encompass how beauty is.
Wonderful. Well, there you have it. Jenny sharing your expertise. So Jenny, where can people contact you in your practice?
Yes, you can give us a call at our main spa line, 669-888-7008. And we are located at 1063 Monroe Street, Santa Clara, California. We are in the process of moving to a bigger location. That's to be soon to be determined. But for now, this is where we'll be.
Awesome. Well, this is great. Thank you again for coming on, Jenny, and thanks for sharing your message.
Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.